Hello and welcome. Today we're diving into a rare and complex topic, bladder rhabdomyosarcoma. This is a type of cancer that develops in the bladder, specifically from cells that are supposed to form muscles. It's important to understand what this disease is, how it affects the body, and what we can do about it. Let's begin our journey into understanding bladder rhabdomyosarcoma. The exact cause of bladder rhabdomyosarcoma is still under investigation, but it's believed to arise from genetic mutations during cell development. These mutations lead to uncontrolled growth of muscle cells in the bladder. Certain genetic syndromes, such as neurofibromatosis type 1 or Li-Fraumeni syndrome, may increase the risk, but most cases occur sporadically, meaning they are not directly inherited. Environmental factors and exposures are also being researched, but no definitive links have been established yet. Rhabdomyosarcoma of the bladder begins when immature muscle cells, called rhabdomyoblasts, fail to mature properly and begin to multiply uncontrollably. These abnormal cells form a tumor within the bladder wall. As the tumor grows, it can invade surrounding tissues, such as the prostate in males or the uterus and vagina in females. Furthermore, the cancer cells can spread to distant parts of the body through the bloodstream or lymphatic system, leading to metastasis in organs like the lungs, bones, and liver. The location and size of the tumor within the bladder will greatly influence the symptoms experienced. Bladder rhabdomyosarcoma is a rare malignancy, particularly in adults. It is more common in children and adolescents, representing a significant percentage of bladder cancers in this age group. The incidence varies geographically, but overall it remains a relatively uncommon cancer. Statistics highlight the need for increased awareness and research to improve diagnostic and treatment strategies. The signs and symptoms of bladder rhabdomyosarcoma can vary depending on the size and location of the tumor. Common symptoms include hematuria, or blood in the urine, dysuria, which is painful or difficult urination, and increased frequency of urination. Some patients may also experience urinary retention, meaning they are unable to empty their bladder completely. In advanced stages, symptoms might include abdominal pain, fatigue, or weight loss. If you or someone you know experiences these symptoms, it's essential to seek medical attention promptly. Diagnosing bladder rhabdomyosarcoma typically involves a combination of methods. A physical exam, including a review of medical history, is the first step. Urine tests can detect blood or abnormal cells. Imaging techniques, such as cystoscopy, where a camera is inserted into the bladder, CT scans, MRI scans, and ultrasounds help visualize the tumor size and location. A biopsy, where a tissue sample is taken and examined under a microscope, is crucial for confirming the diagnosis and determining the type of rhabdomyosarcoma. Rhabdomyosarcomas are categorized into different types based on their microscopic appearance and genetic characteristics. The two primary types are embryonal and alveolar. Embryonal rhabdomyosarcoma is the most common type and typically affects younger children. Alveolar rhabdomyosarcoma, on the other hand, is less common and tends to affect older children and adolescents. Accurate classification is crucial as it influences treatment strategies and prognosis. Treatment for bladder rhabdomyosarcoma is complex and often involves a multidisciplinary approach. Surgery such as partial or radical cystectomy to remove the tumor and surrounding tissue is a key component. Chemotherapy, using powerful drugs to kill cancer cells, is typically administered before or after surgery. Radiation therapy, using high-energy rays to target cancer cells, may also be used, especially if the tumor cannot be completely removed surgically. Clinical trials are ongoing to explore new and innovative treatment options. Currently, there is no known definitive way to prevent bladder rhabdomyosarcoma, primarily due to its largely sporadic nature and unclear etiology. However, minimizing exposure to known carcinogens and maintaining a healthy lifestyle could potentially reduce the risk of various cancers in general. Genetic counseling may be beneficial for individuals with a family history of cancer or genetic syndromes associated with increased cancer risk. The prognosis for bladder rhabdomyosarcoma depends on several factors, including the age of the patient, the type and stage of the cancer, and the response to treatment. Early detection and aggressive treatment improve the chances of successful remission. Recent research is focused on developing targeted therapies that specifically attack the cancer cells while minimizing damage to healthy tissues. Scientists are also exploring immunotherapy, which harnesses the body's immune system to fight the cancer. These advances offer hope for improving outcomes for patients with bladder rhabdomyosarcoma.